friends in anatomy and physiology class. This is Hassan Nafid, your anatomy and physiology instructor at Madison College in Wisconsin. We'll continue talking about the muscular system. This time we're going to talk about the muscles of the thorax, muscles of the abdominal wall, and muscles of the back. Muscles of the anterior abdominal wall, muscle of the thorax, helps to move the vertebral column. They also helps to move the ribs, and that helps in the act of respiration. Muscles also helps to move the upper limbs, and it also helps to move the abdominal content and help in expulsion of the abdominal contents. We have models here. We're going to look at and identify these muscles of the vertebral column, muscles of the anterior thoracic wall, and muscles of the abdomen. Looking at the muscles of the anterior chest wall, this is the Victrolas major. Victrolas major is a superficial, large fan-shaped muscle that covers the upper portion of the chest, as you see here. It originates from the clavicle, from the sternum, and the first 6 ribs cartilage. So the cartilage of the first 6 ribs. The first rib is usually behind this clavicle. You won't see it. The first one you see, the second, third, fourth, sixth, 5 and 6. It originates from these, and it inserts its fibers inserts by a short tendons into the greater tubercle of the humerus. The Pectoralis major muscle is a prime mover of the arm. It also flexes and adducts and medially rotates the arm. It helps in adduction, which moving the arm that way. It also helps in flexion and medial rotation of the arm. The Pectoralis minor is underneath the Pectoralis major. You have to lift the Pectoralis major so you can expose the Pectoralis minor muscles. Moving lateral and away from the Pectoralis major and Pectoralis minor, you will find the serratus or serratus anterior muscle here. These are the fibers of the serratus anterior muscle. Let me just make it a little closer to you here. Magnify it, get it closer to you. You can take a look at it. So if you take a look at the muscles, this is the serratus anterior. These are the muscles of the fibers of the Pectoralis minor, Pectoralis major. In between the ribs, you will identify the muscles of the intercostal muscles, internal and external intercostal muscles. Internal and intercostal internal and external intercostal muscles helps to move the ribs and helps in expansion and movement of the thoracic cage up and down, or outwards and upwards in inspiration, and downwards and inwards in expiration. So external intercostal and internal intercostal muscles. These are one of the respiratory muscles that helps in respiratory efforts. Taking a look at the abdominal muscles, we will find the rectus abdominal muscle. This is the rectus sheath. We also find the external oblique muscles, the internal oblique muscles here, and the transversus abdominis. I'm going to make it a little bit closer to you so you can take a look at the fibers, the direction of the fibers. If you notice here, fibers of the external oblique, they go downwards and they go medially. External oblique muscle is the most superficial fiber, right there, and the fibers, as we said, runs lateral, they run downwards, and they run medial towards the midline of the body. The external oblique originates from the anterior surface of the last 8 ribs. Last 8 ribs, and it inserts into the iliac crest. If you look at the iliac crest here, they insert into the iliac crest. Let me just make it a little bit closer to you here. Take a look at that. and this is the iliac crest, and they insert into the iliac crest. The internal oblique on the other side, if you take a look at it here, internal oblique muscles, the fiber runs at a right angle to the fibers of the external oblique. So the external oblique runs downwards and medial, and the internal oblique fibers runs at a right angle to it, and that means it runs up, and it runs lateral. So lateral and downwards or upwards. Upwards this way. Bring the camera a little bit so you can take a look at the fibers here of the internal oblique. You're gonna see the direction of the fibers, the way it runs. So the fibers runs at right angle, if you see, and they also run upwards, and they run outwards, out and up, the direction of the fibers. Internal oblique, external oblique. External oblique looks like you're putting your hands in the pockets of your winter jacket. That's the direction of the fibers. While the transverse abdominis muscle is a muscle that runs horizontal. The internal oblique muscle are originated in the iliac crest. They are originated in the iliac crest, and they insert in the costal cartilage of the last 3 ribs. So almost at 11 and 10 and 9, they insert at these ribs, the costal cartilage of these ribs. Both these internal oblique and the external oblique muscles, both of them, they kind of work to aid in the movement of the back, to rotate the back. So when the back rotates, the body rotates right and left. This is done by the external oblique, and they also flex the trunk. They help to flex the trunk. The fibers of the transverse abdominis muscle, and this is the deepest muscle layer, which is the last one that is in contact with the peritoneum. These muscles, as we said, they originate from the iliac crest, and they originate from the last, or the cartilage of the last 5 or 6 ribs. They insert into the pubis, and they compress the abdominal wall. They compress the abdominal wall and helps and aid in expulsion of the abdominal content. Now we're going to move and look at the muscles of the back of the body, upper back and lower back. Here, you're going to identify the trapezius muscle, which is fans from here to here. This is a latissimus dorsi muscle. Taking a look at it, the trapezius muscle is the most superficial muscle of the posterior part of the neck and the thorax. It's broad, does have a broad origin, and has a broad insertion also. It is originated from the occipital bone, and all cervical and thoracic vertebra. Occipital, if you see here, I'm going to make it a little bit closer to you. Let me just magnify it. If you look at it, the trapezius muscle will originate from the occipital bone. And this is right here. Back a little bit for you, the camera, so you can look at it. Looking at the occipital bone here, trapezius comes down, and then from the cervical and thoracic vertebrae. You can put the camera a little bit closer here so you can take a look at that also. Tip it over a little bit so you can see what we're talking about. So the trapezius originates from the cervical and thoracic vertebrae, as well as from the occipital bone, and it inserts into the acromion and spinous process of the scapula. It inserts into the spinous process and into the acromion of the scapular, and it's also inserted into the clavicle somehow or partially. What does it do? It extends the neck. Trapezius extends the neck, retracts or abducts the scapular, and stabilize the scapular also. The second muscle that we're going to take a look at is the latissimus dorsi. Latissimus dorsi is here. It's got a broad ligaments also. It's a flat muscle on the lower back, and it is extended across and from top to bottom. Latissimus dorsi originates from the lower 3 to 4 ribs and the inferior spine, and in the iliac crest. It originates from all these areas, and it is inserted into the proximal humerus. The insertion is in the proximal humerus. What does it do? It is the prime mover of the arm. Latissimus dorsi is the prime mover of the arm. It extends the arm. It abducts or adducts, medially rotates the arm, and brings the arm down in power stroke, for example, as in striking a blow in when playing tennis. Also, we have the rhomboid major, rhomboid minor here, rhomboid minor on the top, rhomboid major. We also have the erector spinae muscle. Erector spinae muscle is a long 3-part muscle. It is does have 3 pieces, lateral and medial pieces. Lateral and medial pieces. This muscle originates from the sacrum and the iliac crest. So from the iliac crest, from the sacrum, from the lumbar, thoracic, and cervical vertebrae. And it also comes from the lower 3 to 12 ribs. And this is depending on the specific part. It inserts into the ribs and the thoracic and cervical vertebra. It inserts into the ribs, thoracic, and lumbar vertebrae. Erector spinae muscle helps to keep the vertebral column in an erect position. It also helps to extend the vertebral column, and it also helps to extend the head. And the lower part here, you will notice the serratus posterior muscle. So these are the important muscles of the back that we have identified.